In performing EKGs, it's very, very important that the CCMA know proper EKG lead placement. You can see here in the diagram, they're showing you proper lead placement for limbs. Now notice here, we've got right arm, left arm on the shoulders. We can also apply right arm and left arm on the wrist. We also have alternatives for right leg and left leg. So we can apply right leg, left leg on the hip, or right leg, left leg leads on the patient's ankles. This may vary from provider to provider. Often providers prefer them to be either on the shoulders or the limb leads for the feet to be on the hips. It's going to be by preference. Either one of these locations for the limb leads would be perfectly fine. You might have to alter according to your provider's choices. Now, with the leads here, patients should be instructed to avoid applying any substance. Remember our leads, they have our electrodes, they have a gel-like substance on the back. So we want that gel to be able to stick to the patient's skin to be able to give us that conductivity that's necessary. So if they're applying any substances, we're going to ask them to avoid lotions, powders, oils, ointments. All of these could alter the ability of the electrode being able to have its adhesive stick to the patient's skin. If in fact you do have a patient that does have oily skin, that's okay. We can cleanse that site using alcohol wipes. Now, if you're using the alcohol wipes, you're going to cleanse the area that appears to be oily. You're going to scrub it vigorously before you apply your electrodes. You might often also have to shave the area if there is hair on the patient's chest, interfering with that electrode being able to stay in place. If that's the case, you may have to shave a small area to be able to apply the patch. And of course, we would do that with our patient's permission. Now with our limb leads, that's going to be our arms and our legs. Our limb leads are to be placed on fleshy areas of the skin. And we're using the same vicinity. So if we're applying our arm leads on the shoulders, then both would go on the shoulders. If we're applying on the legs, we wouldn't do one on the hip and one on the ankle. They would both either be on the ankle or both be on the patient's hips. And in certain cases, there may be patients that have amputated limbs. So if the lower limb is amputated, then the electrodes would both be placed on the abdomen, right above the patient's hip area. If you have a lower arm amputation, those electrodes would be then placed on the patient's upper arms. And remember, altogether, we're going to be applying 10 leads, 6 precordial chest leads, along with 4 limb leads. Now, once those electrodes are in place, we can now apply our lead wires. The lead wires are connected to the electrodes, and the electrodes have that gel substance that sticks to the patient's chest areas. These leads, once they're in place, they're going to give us 12 different views of EKG tracing. They are color-coded and they're also labeled. So notice here you can see right arm, left leg, color-coded as well as labeled. And I would encourage all of you to make sure that you're reading both and not just relying on the color. You're reading your electrodes, or you're reading your leads, as well as knowing the appropriate color. I wouldn't suggest that you rely on one without the other. You always read your leads. Improper attached lead wire could result in no recording at all or improper recording of the waveforms.